Many of you are turning to Google to get your answers for coronavirus-related questions. So we turn to Google to find out what those questions are. Here are the top 10 questions in the last week in South Dakota and the answers. As of Wednesday, there were 393 positive cases of COVID-19 in South Dakota, including 6 deaths. 146 people have recovered. It depends on where you look, the CDC or Johns Hopkins University. But as of Wednesday, the United States had more than 400,000 confirmed cases. We don't entirely know how COVID-19 began. We do know the first known case of this new strain of coronavirus was detected in Wuhan, China back in December of 2019. And there's been some research presented since about how it started. I put links to those in this story. This is a common question, but not a really good answer. Social distancing is working to reduce the spread. Scientists are working on developing treatments and vaccines, but viruses are unpredictable. Dr. Anthony Fauci addressed this question at Tuesday's White House Coronavirus Task Force media briefing.
Though I'm humble enough to know that I can't accurately predict that by the time we get to the fall, that we will have this under control enough that it certainly will not be the way it is now, where people are shutting schools. My optimistic side tells me that we'll be able to renew to a certain extent, but it's going to be different. Remember now, because this is not going to disappear.
These numbers also change daily. But as of Wednesday, 6 people in South Dakota have died, nearly 14,000 people in the United States, and nearly 87,000 people across the globe. Well, some new research in the New England Journal of Medicine gives us insight into this. The answer, it really depends on a number of conditions, but usually between several hours and several days. The virus is viable for up to 72 hours on plastics, 48 hours on stainless steel, 24 hours on cardboard, and 4 hours on copper. Nearly 14,000 as of Wednesday, a majority of those in New York State. There are 3 major symptoms that usually show up 2 to 14 days after exposure. The first is a fever. The second is a cough. And the third is shortness of breath. Yes, the virus can be. It's primarily spread person to person through what's called respiratory droplets. That's why health officials are telling people to be 6 feet away from each other using social distancing. Those respiratory droplets come from when a person sneezes or coughs. This is a complicated question, and scientists are still trying to figure it out. But what the CDC is recommending for people who have stayed home, who are in home isolation, if they have not tested to see if they are still contagious, they have to match 3 things. No fever for at least 72 hours, all other symptoms have improved, and at least 7 days have passed since the first symptoms first appeared. Of course, a lot of this information can change on a minute-by-minute basis. You can get the latest information here on KELOLAND.com and on the KELOLAND News app. We have links to the State Department of Health and the CDC as well to get the latest guidance.